Well, you never really know what a work day is going to bring, and it's important to be open and ready for anything that might come your way. This mom had originally planned on having all-natural delivery, but really quickly it became evident that for the safety of her and for her baby, she was going to have an emergency cesarean section. What we decided to do was take her back to the OR very quickly, and we were able to successfully place a spinal anesthetic that allowed her to be awake for the birth of her baby. During this time, I had to help her make the transition from wanting to have a natural birth without any intervention to being ready to have an emergency major surgery.
CRNAs are nurses to start with, and they've established a great relationship with patients. First of all, they've learned the medical conditions of the patient. They have a great psychosocial balance in working with the patients. They're unique people because they can plug into the environment anywhere and provide their skills at whatever area they're needed. The value that they bring to the table is not only the quality of the service, but the cost of the service. So they're very cost efficient. They have great efficacy in taking care of patients.
Almost all patients have fears about anesthesia, some more than others. Your ability to communicate with patients and make them comfortable and at ease is crucial in having a good anesthetic. All the CRNAs that I worked with have been able to accomplish that successfully. Without exception, they've tended to make the patient at ease and are extremely good at it. It's just making the patient comfortable and reducing their anxiety, which provides for a better outcome.
CRNAs are sometimes the people that make the real difference when you're trying to help a patient who's in lots of pain. We have pain in trauma, we have pain in obstetrics, and some women are at their limit of managing that pain and being able to cope with it. And the way the CRNA can come in and just by their presence and their confidence, providing relief of that pain in a very timely, very experienced, very prompt manner, makes all the difference to that person in the end.
We have seen in our industry tremendous change, both in the medical side, the technology side, administrative side. We are very pleased to see how nurse anesthesia has really promoted the healthcare and well-being of patients, and nurse anesthesia is a great reason why patients want to come here.
CRNAs are the anesthesia provider for the future. We have an ability to be critical thinkers, to develop our skills and our techniques so that we move forward and provide care to an evolving healthcare profession.
When a patient comes back to the operating room in a hurry, it can be very easy to get wrapped up in the tasks that need to be done and forget about the person who is in the room about ready to have this procedure done. And I always make that person's needs and emotions my priority in addition to the work that I'm doing for her safety, because she will be awake and won't be receiving any sedation, and it's important for her to feel comfortable with what's going on in a very stressful situation. Fortunately, everything turned out very well with a healthy baby and a safe delivery. That was a day that I really loved my job and was glad that I had the intuition and the skills necessary to keep my patient safe and comfortable.